how these technologies and other ideas came about, or
Uh-oh, I think we lost Paul when I clicked record. Maybe give him a moment to log back on here.
My sincere apologies. I left and I'm back. Sorry about that.
No worries.
Wrong button. Okay, there we go. I was saying that I would love to get questions. So please, as you goes along, if you have a question, feel free to interrupt me. I'll also try to elicit some questions as we go. And thank you for that kind introduction. I am an associate professor at UCSF, based at San Francisco General Hospital. I practice both in medicine and pediatrics, and not as much as I used to, because I have a NIH-K award that lets me do mostly my research, which is related primarily to the insecticide-treated bed nets. So that's what we're going to talk a lot about today. We'll go a little bit back into some of the questions that got me interested in insecticide-treated bed nets, and then come up to the present day where I'm doing some work in Uganda, trying to understand how families and children in particular use their bed nets, and try to come up with some better ways to improve bed net use to help prevent malaria. And here we go. I do need to just a quick disclosure statement. I have a small nonprofit organization that I've been running since after I got back from the Peace Corps almost 20 years ago now. But it's a small nonprofit that is focused on malaria prevention, other research projects. I don't make any money from this, but I do have to just disclose that they've funded some of this research in the past. Also, as Sohail mentioned, I've invented some technologies that there's still some intellectual property. It's very much non-remunerative and doesn't make me any money at all. But it is something I have to talk about. And we'll talk more about this Smartnet device later in the talk. So just a quick outline. Given that there's sometimes younger people on the call, I like to give my thoughts on kind of global health careers, because I remember when I was interested in working in global health, I was wondering how to do it, and I'll just kind of give my perspective. We'll talk a little bit about malaria and bed nets, the problem of malaria, some conceptual frameworks, some of the early studies that I did, and then we'll get into more recent things with the Smartnet device and some advances in Uganda. So just a quick 2 slides on my thoughts on global health careers. You know, I did not study medicine. I was not pre-med as an undergrad. I did computer science and anthropology at Middlebury College. Most, as liberal minded education, broad education as you can think of. And, I ended up going back and kind of doing an ad hoc post-baccalaureate program, taking organic chemistry here and there, taking other classes, but was able to eventually get into a medical school, great medical school, and do great training at MGH, and now have made it to UCSF. So kind of maybe a winding path there. And that's kind of the theme here, is there's a lot of winding paths. I studied anthropology as an undergrad, spent 2 years in the Peace Corps, was able to start my nonprofit when I got back, kind of in the field of technology. I was a computer science major. I actually worked for IBM for a couple of years as a software engineer and consultant, and then moved into developing some technologies of my own. And then in terms of research, I started out raising money from family and friends to do my first randomized controlled trial, which we'll talk about here, while I was a Peace Corps volunteer. And then now I'm able to be NIH funded and hopefully move on to an independent research career. I think the point is, you look at these different color streams going on, and the reality is it's a big mush. And the underlying thing is following the different topics you're interested in, the things you're passionate about. And following those passions can pretty much get you wherever you want to go. And being at a place at UCSF, or having good mentors, is one of the best things you can do to help advance your career. So I've been lucky in that regard. Okay, let's talk about malaria. Some of you may know, actually, before we get to this point, that malaria has been estimated to have killed more people in the history of humankind than any other communicable disease. It used to be a much more significant problem, but we've been making a lot of progress. And However, in 2019, there were still more than 200 million cases, and there were 409,000 malaria deaths worldwide. There are two crucial facts here, though. First, the malaria deaths are very concentrated in under 5-year-old children. You can see here, that's the bright pink in this chart here. Under 5-year-old kids make up the vast majority of mortality from malaria. Second, the vast majority of malaria, 90% in fact, is concentrated in Sub-Saharan Africa. So by making progress over the last 15 years, where we essentially cut malaria mortality in half, now malaria is essentially concentrated, at least the the kind that kills people is concentrated among young children in Sub-Saharan Africa, and that's where I do a lot of my work. So one of the big advances over the last 20 years is the use of these long-lasting insecticide-treated bed nets. So these bed nets, many of you may be familiar with them. They're nets that are meant to be used around your bed while you sleep at night. And they're not just plain netting, but actually the netting is impregnated with an insecticide that is safe for people, but over time will kill mosquitoes that land on them. So it provides both a barrier protection and also will actually kill mosquitoes in the area. And these have been associated with significant improvements for child mortality, up to a 23% decrease in mortality in randomized trials. And the bed nets themselves accounted for almost 70% of the reduction in malaria incidence, that halving of malaria from 2000 to 2015. The issue is, since 2015, when we've kind of concentrated everything in Sub-Saharan Africa, we've seen a plateauing of the improvements we were making. And so the question is, are these mosquito nets not working, or what's going on? Bed nets are incredibly prevalent. The WHO has called for 3.2 billion people worldwide to have access to bed nets, and 253 million were distributed last year alone. And this is something that's been continuing. It's upwards of 200 million every year, because these things need to be replaced every 2 to 3 years. So how do bed nets work? I've already kind of mentioned this. They provide an individual protection with the barrier, blocking a mosquito from biting you. But they also provide a kind of a community-wide vector control by, as the mosquito lands on the bed net, those mosquitoes die, and then obviously they can't propagate malaria to the next household. And then when mosquitoes die, that's one of the most effective ways of preventing malaria for a community. So my conceptual framework, where I started out by thinking about malaria, I was a Peace Corps volunteer in Madagascar. Malaria was not seen as really significant in that area because they didn't have much access to bed nets. So a lot of my early work was in this idea of how do we get bed nets into households? And secondly, once the bed nets are in the households, how do we get people to use them? Both steps are required. You can't prevent malaria with a bed net if people don't have them and don't use them. So that was the kind of framework behind the work that I do. So some of these first studies I'm going to show you are focused on kind of number one here, getting bed nets into the households. And then later work, and what I'm doing primarily now, is understanding how people use their bed nets and try to help them use them at the times that they're most effective. So how do we get bed nets into households? Some potential barriers are things like knowledge. Maybe people just don't know that if they have a bed net or use a bed net, it can prevent malaria. So maybe we can come up with solutions like education, do education campaigns. In Madagascar, they did a lot of what's called sensitization, which are basically campaigns, one-on-one or big group campaigns, educating the population, educating people in the villages about malaria. So this is a study I did back when I was a Peace Corps volunteer, where we actually looked at, we created a malaria knowledge index, and it essentially showed that the most effective, the most predictive exposure was the more knowledge you had about malaria, the more likely you were to actually have a bed net in your house. Maybe perhaps not surprising, but it basically shows that people need to understand that how malaria is transmitted, and they need to know what's available to them in terms of prevention. So then there are other potential research questions that we can get into, and potential barriers to getting bed nets into households. Number one is availability. So this is sort of on the supply side. maybe we need to make better delivery systems, get these bed nets to the households that are the furthest out or the least socioeconomically advantaged so that they can actually have access to these as well. Agency, this idea that maybe I can prevent malaria among my family. That's kind of a surprise sometimes to some villages, for example, who have always just lived with malaria. The ideas like women's empowerment, like helping mothers understand that they can, by giving the mothers bed nets, they can use them to protect their children. Another potential barrier is cost. So this was a big question a few years ago, but it was the source of one of my randomized trials that I ran, was whether bed nets should be given for a very small price or we actually should give them free to everyone. So this study, I created it as a Peace Corps volunteer in Madagascar. We randomized villages to receive a coupon for a bed net at different prices. And this is just sort of the randomization schedule on the right side here, from free all the way up to market value, which was about $2.50 at the time. There were no universal distribution campaigns at this time in this area. And so this was essentially, like, for most people, the first bed nets they were getting. And so we went around, we gave everybody coupons, and we had randomized them previously to these different levels of price that they could then return the coupon for and get a bed net. So these are some of the participants taking part in the study with their coupon. So at baseline, only about 4% of households actually owned a bed net, which is quite low, and only 1% reported using it. Just going to skip along here and get to the graph. We had long lines. Everybody, the coupon was, everybody wanted to get their bed net. They were very interested in getting their bed net. This is kind of the main take home here. So along the x-axis, you're seeing those different price points from free, 1,000 RERE all the way up to market value. And then on the left, you're seeing the percentage of the proportion. The dark blue is the proportion of households that actually ended up owning a bed net after I think it was after 3 months. And then the pink there is actually households that reported using their bed net. Interestingly, you'll note this at the free end, there is this gap where 100% of households that got a coupon to get a free bed net went and redeemed it, but only just over 50% actually reported using their bed net. What I find really interesting is that's markedly different than you see in the 1,000 level here, where you see nearly 70%, 75% got their bed nets and almost 70% report using them. And so this presents some barriers to the idea of distributing things for free, especially if people don't understand what they're for or why they need them. There is this idea of a kind of a sunk cost effect, that where you provide a very small nominal investment, and you can actually, you might be more likely to value that good, when things that are given out for free have actually been shown to be less valued. Obviously, that's a big challenge in poor households. So the real art here is trying to figure out, first, can you overcome that barrier and create value for the bed net through education or through other campaigns? Or do you need to charge a very small price, for example, to get people to use their bed nets? Any questions on that? I'll tell you that now the standard is universal free distribution of bed nets to a certain number. So, for example, the WHO has asked for people to get 1 bed net for every 2 people, essentially. And what these universal campaigns do is they map out houses in a region, in Uganda, for example, and they go to each house, or they go to a local community center, and then they register each household, and they provide enough bed nets to cover people within the household. The issue is that even with these universal distribution campaigns, there's still not enough bed nets to go everywhere. So people are still forced to go to the market and actually try and buy them themselves. And there are subsidized bed nets that you can get in pharmacies, for example. But again, that's where the ability to pay for these things and whether you value them or not really comes into play. The very few campaigns that I've seen that have achieved complete coverage to the WHO goal, just because of the challenges of getting so many bed nets out. So still paying for bed nets is still an active thing for people in, at least in Sub-Saharan Africa and the countries that I've worked in. So another interesting study and kind of a secondary analysis that came from this is that having a child under 5 was highly predictive of using a bed net. So the households that had a child under 5 within it they had overall, the bed net use was like the odds ratio, they were nine times more likely to use their bed net compared to the other households. So it certainly was salient to these households and the people in this area that children under 5 were at higher risk, and so that they probably should get a bed net and use their bed net. So that was heartening and showed obviously that education can have some effect as well. Another study that we did in Madagascar while I was a medical student is we actually looked at whether we could overcome those initial barriers to those price barriers we were seeing, where as price goes up, we saw the demand for bed nets going down. Could we overcome some of those barriers by giving incentives? And in particular, I was focused here on that first plot, this part right here, where at the free level, where you see this big gap between use and ownership. Is there a way we can help incentivize people to use the free bed nets that they've gotten? So what we did is we created another randomized trial to look at incentives, behavioral incentives. So, this has been studied pretty well more recently in like vaccines, as obviously I'm sure you're hearing about COVID vaccines and other kind of lottery systems or even paying people to get vaccines. Back when I ran this study in the 2005, I think, there were not a lot of studies looking at the developing countries, but they've been improved recently. But no study really had looked at encouraging the use of bed nets in this way. So created I guess it was 2007, created a randomized trial among 21 villages. We gave coupons for a free bed net to all households. So they got one free bed net per household. And then the intervention households, which is just half of those, were told that they would get an unspecified bonus in 1 month if they were using their bed net. And the way we defined using their bed net is it had to be strung up, like tied up over a bed. And that was how we would define whether they were using their bed net at that 1 month visit. And this bonus was, as I mentioned, was unspecified. We said you'd get a prize. We didn't tell them how much they would get. And what we ended up giving was a very small kind of like bag of rice, which is one of the local staple foods. We gave a bar of soap, some things that cost maybe around $2 total. So it wasn't an exorbitant bonus, but it was something that the households would value. So this is the results, the plot from that study. That we showed that at 1 month, baseline, you could see the bottom left, the axis at the origin here, only 6% of households actually were reporting using a bed net at that point. And after 1 month, you can see that the dotted line is the control households, the solid line is the intervention households. After 1 month, we got use up to 99% in the households that were told they would receive a bonus, and pretty high at 78% as well in the control. So that's encouraging. We did go back after 6 months, that's 5 months later, and looked at the same question. And you can see here on the top right that some of the use in the intervention households actually decreased. So those people either took down their bed nets or gave them away after they got their prize. But interestingly, in the control group, their use increased a little bit, showing that perhaps they were, coming to learn about the value of the bed net over time, or just they took them a little while to actually get their bed net up and start using it. There may have been some seasonal effects. Can't remember exactly what what months we did this, but it may have been rainy season interspersed here that might have had an effect as well. But essentially, we showed that with small bonuses, we can boost bed net use in the early term. And this differential use, I'm still interested in looking at this as a sort of a programmatic fashion, because this differential use is use that would not have occurred otherwise. And the cost effectiveness of these small interventions may actually turn out to be favorable in the sense that we could use small targeted incentives Perhaps in certain groups like pregnant women where use of bed nets is really important, we can maybe use these incentives to help people be more adherent to bed net use and then have some positive effects on preventing malaria or preventing like bad outcomes among their newborns. So that's something I'm still interested in. But we were able to show that after about a month, we could increase bed net use, but then it slowly waned over time. Any questions on that? So we'll move to a different kind of topic.
I had a quick question. Hi, my name is Maron. I'm one of the PEDS residents. During the visits, was there any re-education on the 1 month and 6 month visits?
So no, when we first we first went out, we gave the coupon to everybody the same. We obviously were telling the intervention groups that there was a bonus on offer, and at the 1 month visit, we just went and checked. There was no additional education in this study, or we didn't encourage bed net use other than the fact that we were showing up to ask about it. So yeah, no additional education campaigns. And nowadays in Madagascar, they have like radio campaigns, and bed net use is far more prevalent. So this area was pretty untouched. It would be interesting to try this study again, using some better methods of measuring bed net use, which I'll talk about coming up next. In a setting that is much more used to using bed nets and where you don't have the 6% at baseline, because that's quite low. Nowadays, most places that are endemic for malaria have much higher baseline rates of use. So that applies to your question because malaria is much more salient to communities nowadays, I would say. So yeah, but there was no other additional education that was supposed to happen here. Thank you for your question. Anyone else? All right. So as I alluded to, one of the big challenges in that study was how do we measure bed net use, right? So it's pretty easy to measure bed net ownership. They can show us their bed net. Bed net use is much harder to measure. So that's going to lead into kind of the second half of the talk and kind of the work that I'm doing more recently. And that's number 2, if you remember on that chart. We got the bed nets to the household. We say we give it to them for free. We say, let's say we have really good education campaigns. People understand at least why we just dropped off a net on their front doorstep. Now, how do we measure whether or not they're using those bed nets that we just spent hundreds of millions of dollars, distributing? So, the most common way that is used are self-reports, which are essentially surveys where they go house to house in this kind of cross-sectional manner. They'll look in the middle of the rainy season, for example, in Uganda, they'll go get a random sample of households in a region, and then they'll ask everybody, did you use your bed net last night? Or did, for example, this person in the household use their bed net last night? And that's the most common way of measuring it. As you can imagine, there are some challenges with that. And I'll talk a little bit about that, because when you're asking people, they can maybe not know whether someone in their household used a bed net last night. They could forget, something called recall bias, or they could actually kind of give an answer like maybe they forgot to use it last night, but they are going to tell you, yeah, I did use it because of the fact that the questioner is asking it in a positive way. That's something called social desirability bias. And I've looked at that a little bit related to bed net use. The issue is that inflates your estimate of how likely people are to use the bed nets that you gave out. So the self-reports are a challenge. Obviously, self-reports wouldn't work in the kind of study I was doing before, where we're also giving bonuses and prizes that would induce people to kind of not give a straight answer. So some other methods of measuring bed net use are what we used in that last study, which was actually visual observation, where we actually asked if we could look over a bed to see if the bed net was hanging. And then there's also other methods that have been used, unannounced visits, where they actually will show up. People are enrolled in a study that they know that at some time they might get a knock on their door at 9:30 at night, and the study researchers will ask to see who in the household is using a bed net. That's been done a few times in different country settings. And then the idea of nighttime observations. There's actually been ethnographers who have slept in a bed, within a household, and have observed people moving around within the household and observed how they use their bed nets at night. And these are all different ways of getting information about how people interact with this preventative health technology. So, I wanted to move towards a more objective measure for monitoring BedNet use, a tool an electronic kind of remote tool that could then give us information on how people are using their BedNets objectively, and then also importantly over time. So we'll talk about that as well, as opposed to just one-time measure, looking at how BedNets are being used day to day or season to season. The first issue is that how do we define kind of like BedNet use objectively? And then there's recent questions about the effectiveness of BedNets. These are, as I mentioned, about that plateau in malaria improvement in Sub-Saharan Africa in particular. One big question is this because BedNets are not working like they're supposed to? Are there adaptations in the mosquito vectors, either with insecticide resistance or actually biting at different times than they used to? Are people actually spending more time outside and not under their bed net at 9 p.m. at night, for example, at which time they're getting exposed to malaria? Or are people just not using the bed nets like they say they are? They're getting kind of fatigued with the idea of having to always put their kid under a bed net. These are all questions that we could answer if we had a better sense of how people use their bed nets and the patterns that people engage when they use their bed nets. And the basic value proposition is that there's a lot of money going into developing new technologies for bed nets. For example, bed nets with new insecticide resistance, new insecticides to overcome resistance, and that's quite expensive. So my kind of argument is that let's really understand how these bed nets are being used so that we can, make these other changes and use our resources wisely. This is a quick slide on this idea that self-reports may be biased. I did a meta-analysis of 19 studies in which, going back to 1989, where I could find both an objective measure, one of those like visual observation or a nighttime visit, and in that same population, they reported out self-reported BedNet use as well. And as you can see here, in this forest plot, the axis going towards the right, toward the positive side, kind of favors a estimation by self-reported BedNet use. And you can see the average was over 13% higher if you took the measure of using self-reports compared to the objective measure. And this actually, in most recent studies, which I'll talk about in a second, is around what I'm finding even in Uganda, even among people that know they're being monitored. So I think this self-reported, what I call it social desirability bias, is kind of an inherent part of any survey, but it's something that plays at least a 15% inflationary role when you're looking at how bed nets are being actually used in reality. And we talked quickly about this, I'll speed through this, but traditional measures are really imprecise. These cross-sectional analyses might figure it out, what BedNet use is in the rainy season or on this day, but then we don't know what BedNet use is a month later or a week later. In addition, there's a lot of within households, as maybe you can imagine with young children, people are getting up to go to the bathroom, or people are waking up, or people are walking around. There's a lot of potential interruptions in BedNet use during the night, and those really can't be measured with these one-time cross-sectional surveys about whether you used your BedNet last night. So there's a lot of variation here, and the importance of that is that for each of these hours, so you can just look at this plot from a study where they did a visual observation. These are entries and exits from the BedNet. So people are coming into the BedNet, people are leaving the BedNet, and every time they're coming in or leaving, they are being exposed to whatever mosquitoes are around at that hour. And so that's my most recent work, is going to be looking at how matching up when people are under the bed nets, or have the benefit of that coverage, and matching that up with when the mosquitoes are around, to try to get a better sense of like what times people are at risk and how much risk people are actually under based on their bed net use patterns. So this goes quickly into kind of Smartnet. I'm not going to belabor this too much. This is that picture, mostly to show you here. This is an unfurled bed net, right? So if that woman were to put her baby under the bed net and put it around the size of the bed, that baby should have the protection of the bed net. Two other ways that bed nets are often kind of stored. This is often because these households are quite small, you can imagine, the bed nets are folded up in this way. This kind of like they gather the sides and throw it on top of the bed net, throw it on top, mostly to protect the bed net from getting, ripped down or dirtied by household living, and also because they often use the bed itself to sit and eat and talk, given how small the households are. The basic idea is that this is how a bed net's used mostly at night, and then during the day, the bed nets are stored typically. So this is a stored net where it's kind of thrown on top. This is another way of storing a net where they kind of tie it up in a knot. So what I created was, this is the Smartnet that I invented when I was a resident at MGH, was actually an electronic device that would measure when a bed net is up or down. So this is the schematic, this is that stored bed net. It's folded up so that people can, go onto the bed and off the bed without damaging the net. And then this is the bed net unfurled. And I'm going to show you some pictures. The blue box here is kind of a mock-up of this small device that I had. And then these green lines are actually a conductive fabric. So the idea is that this conductive fabric, when it's like in this conformation, when it's all unfurled, the conductive fabric is not touching anything else. However, if we go back one, you can imagine how the conductive fabric, once the bed net's all collapsed and gathered on top of the bed net, the conductive fabric actually can create a circuit. And by detecting circuits between the different walls of the bed net, we can detect whether the bed net is actually stored up in this fashion, where a circuit is completed, or here where there's no circuit completed and actually the bed net is down. And it turns out that this is quite accurate. And I'll show you some data on some tests we did of that. This is just some of the development work that we did, doing some 3D design, CAD design, trying to come up with the optimal layout of the conductive fabric. And then this is the end result of our most recent smart nets that we use in Uganda. They have some frills. People actually tend to like the design and the colors that we added, but in reality, those gray lines, those cloth, those are actually conductive fabric that can actually, with a very small electric charge, we can actually detect circuits being created when you fold them up. This is a picture of that, like at least an early prototype of the actual SmartNet device. Looks a little complicated, but essentially it's just a customized Arduino board that I got some engineers to help me develop. And then this is kind of the take home is that the initial SmartNet tool, it's quite accurate in measuring whether a bed net is up or down, 98% accurate. It can last up to 8 weeks on just a couple of batteries. So we're getting not just one-time measures, but we can actually get measurements from day to day. And then we can integrate it into a WHO-approved bed net, so that we're also still providing people the protection that they need for malaria. And the cost ended up being around $120. We have to source custom electronics from the United States. But actually, all the conductive fabric and the designs were all created in Uganda with local seamstresses that I trained, and we were able to get these bed nets made. Questions about that or how that exactly works? I'll preempt a question that often comes up. Clearly, if you're looking at this bed net, and you're looking at the bed net that we had before, or the one you would buy out of a bag, it clearly looks different. So one of the big challenges with this early version of SmartNet is how obvious it is that you're being measured. And that's kind of alludes to something called the Hawthorne effect, where you might act differently if you know you're being measured. So that is something that I'm addressing in kind of more recent work with some new technology, which I'll talk about towards the end. But excuse me, but that is something that was unavoidable, unfortunately, with this approach. But I also have some evidence that it didn't play quite as big a role as we might think. So just a couple initial studies that I did. First, kind of an acceptability study. I wanted to make sure that individuals in Uganda would be acceptable or interested in having this sort of monitoring. one thing, again, another preemptive answer to a question is that I'm not imagining these devices to be, for example, given out to thousands or millions of people so we can track everybody's BedNet use. The idea is to actually use this in very targeted research settings so that we can understand, again, that overlap between how people typically use their bed nets and when mosquitoes are around, and to hopefully come up with better interventions. So these are not meant to be acceptable to to people buying them off the shelves. The plan is to use them as research tools. So for a quick acceptability study, initially in Uganda, we actually went and showed the technology, showed the device, showed the BedNet to 50 mothers in Uganda, asked them on what they thought. I was really also trying to get at this: how would people feel about this idea of being monitored, having your BedNet be monitoring whether you're using it or not? Turns out, in this study, at least, everybody was very positive about it. I've done some more recent work, which was most generally positive as well among people that actually were using the bed nets for 6 weeks. So I think I can talk about that quickly here. So essentially, the next study, after we kind of showed that people at least responded positively to the idea of being tracked with their bed net use, we enrolled 10 households in a pilot study in southwestern Uganda. Again, keying on mothers and pregnant women. We gave them one Smartnet. We put it over the area that they regularly used within the household, and we asked them to use it like they would any typical bed net. We didn't ask them to use it in any special way. Again, Hawthorne effect notwithstanding. And then, the way the bed net works is it measures every 15 minutes whether the net is up or down, and then it creates sort of just a log of like on this day at this time the bed net is up. And then the next one, 15 minutes later, it's down, and it just continues. So you get this like longitudinal record of whether the bed net was up or down at a particular time. So each of these households used the bed nets for 6 weeks. And this chart, I like this chart because essentially these black lines here are each plot. This is numbered 1 through 10. It's a little hard to see, I apologize, but essentially these black lines are times when the bed nets are in use. Unfurled around the bed, and then it goes from 1800, which is 6 p.m. at night, until 9 a.m. the next morning. So you're looking at nights of use over time along the x-axis. It's like 6 weeks on average. And so what I like about this chart is it shows incredible heterogeneity, right? People don't use their bed nets uniformly, even within a household, and even if they use it pretty uniformly within a household, between households you see quite drastic variations. Household number 1, for example, had a bunch of hiccups and missing of use. Household number 8 just kind of kept their bed net down all the time, or a good majority of the time, and never folded it up. Household number 10 was a little more regular. So each of these households use their bed nets very differently. And I love that because that really points to what I'm interested in, which is how do those actually different uses of bed nets, first of all, why are they happening that way? And then second of all, how does that intersect with whether that household's at risk of malaria or not? And you can imagine if we understand better how to classify these bed net use patterns, either as good or bad, we might get a better understanding of why particular households are at higher risk of malaria or not. And that could give us some keys into perhaps new interventions or ways of improving malaria. So that was a pilot study we did in Uganda. And that was allowed us to come up with some new metrics for how we measure bed net use. So now I could actually tell you how many hours per night people were using their bed nets. I could come up with some average, what called mean adherence. So between 6 and 9 p.m., what proportion of hours are the bed nets being used? I could actually tell you what time people put their bed nets down and what time they fold them up. And that actually is becoming of more interest recently because mosquitoes are being found to change the density of mosquitoes compared to before prevention was really wide scale. They've actually seen that mosquitoes are adjusting and changing their behaviors a little bit. So knowing when people are putting their bed nets down might give us some sense of when they're being exposed. And then it gives us some information about interruptions in use. How many times during a night does someone get out of the bed net and get exposed to mosquitoes? I'll kind of skip through this because I have a little more recent data, but essentially, these are kind of the plots we're able to come up with. This is the mean adherence by night hour, like what percentage of the bed nets are down. Oh, sorry, what percentage of nights are the bed nets down by a certain hour of night? Again, very heterogeneous across the different 10 households. And this is just a kind of a bubble plot of looking at interruptions of bed net use. And the area of the circle is how long the interruption occurred. And then it's plotted out over clock time. And you can see a lot of interruptions, not surprisingly, happening early in the night when people are getting into the bed net, getting out of the bed net, and then fewer interruptions happening while people are sleeping. But again, another way of looking at how people are using their bed nets. So the issue with this study was a pilot studies. I didn't have any evidence I didn't have any mosquito data. I didn't know when mosquitoes were around. I only had about 10 households. So this is my most recent study looking at the use of bed nets in Eastern Uganda, which is a higher transmission setting. And the idea here was actually to replace every bed net within a household with a Smartnet. We also had this is a study that's run by Grant Dorsey and a group at UCSF, where they actually have a cohort of households that they follow every 2 weeks, asking questions about their bed net use, asking questions about when they put their bed net down. Every 2 weeks, they actually collect mosquitoes by putting little traps in the rooms and tracking how many mosquitoes are around. So what we did is we integrated the Smartnet devices into 20 of these households, which covered about 99 different people. And we got almost 3,000 nights of monitoring, over 70,000 hours of bednet monitoring. This is just some basic characteristics, but the essential facts are that we put about 2 bed nets per household. And we had a nice variation in age groups as well, which just gets us back to the kind of pediatric focus, and that'll come up in the predictors of bed nets as well. So this is the first kind of data that came from that study, where we actually looked at what time people were putting their bed nets down. So on the left here, you have 2 categories: Smartnet measured clock time that they put their bed net down, and clock time that they put their bed net up. And across the right here is the overall averages and then broken down by age groups. And the really first interesting thing that I found is that children that were 5 to 10-year-olds on average, according to their Smartnet, put their bed nets down around 8:55 at night, which may seem a little late, but is certainly on par with kind of cultural behavior in Uganda. Interestingly, they put their bed nets down earlier, almost 20 minutes earlier than the children under 5. And so people might ask why that is. But if you notice that the adults over 30 and the children under 5 are putting their bed nets down about the same time. And this probably has to do with the fact that a lot of children co-sleep with their parents, or children under 5 often will not put their bed nets down themselves, but perhaps the adults are coming by, the kids go to sleep earlier, the adults come by, put the bed nets down around them after they're asleep, after they've gone to sleep, and then the adults go to sleep themselves. So I found that quite interesting. In addition, we see that so now we're going to these yellow boxes are self-reported times that people are that people are going to bed. And you're comparing that now to the actual Smartnet measure, the times that people were, bed nets were going down. And you can see in particular for the 5-year-olds that, their bed nets are going down around 9:15, but they're being reported going to bed at, 8:30 on average, 8:40. So in fact, those 36 minutes per night of missed bed net coverage, right? If you could put the bed net down around the child when they are on the bed, when they first go to sleep, that can actually add up to almost a full missed night of use every 2 weeks. And so a full missed night, every 2 weeks, depending on how many mosquitoes are around, is actually you're highly at risk for contracting malaria. So this is the sort of evidence that I think we can glean from these really quantitative and precise measures. And it really invites the qualitative inquiry, like, what exactly is happening around the household. I'm just, I'm telling you what I think is happening, but obviously going in and saying, oh, who's responsible for putting the bed net down in your household, and give me a circumstance of how that works. So that's pointing towards kind of more in-depth qualitative inquiry that I've done some more, that I'm working on. I have some funds now to do that in the upcoming cohort. Questions about that? Okay. I think I'm going to go through, we have about 10 minutes left. I'm going to go through a little quicker through these because it's essentially the same kind of bottom line. And then I'll leave a little time open at the end for some questions as well. This is, again, we talked about those different metrics of use. The last slide, we talked about what time bed nets are going down. Here, we're actually looking at the average duration and using a model. I'm looking at mean duration by age group. So in this plot, you're seeing that the under 5-year-olds and the adults are using their bed nets on average around 9 hours per night. And then the other age groups, the children 5 to 10, other children, school-age children up to 20 years old, and then 21 to 30 are actually using it way down to 7 hours a night. The reason this is important, is that these 5 to 10-year-olds are sort of notoriously poor users of their bed nets. Probably, I would guess, because they're actually put in charge of putting their bed nets down themselves. You can imagine yourself if you're, for example, I have a couple of kids that age, and they're kind of responsible for brushing their teeth. You can imagine their toothbrushing is not quite as good as when I'm brushing my 3-year-old's teeth myself. That's kind of how I think about it. The issue is that even those children don't often get as sick from malaria because they've already developed some immunity over time from when they were younger. They actually can act as a community reservoir. So they're not using their bed net is actually putting at risk the under 5-year-old who's sleeping in the room next door or in the house next door because they have the malaria parasite in their bloodstream due to immune tolerance, essentially. So the fact that these under 5s are not using their bed net is actually important for the community at large. So that's another reason that we look at that. Then another metric that's interesting is actually total nights of misuse, like people forget to put their bed net down or just don't put the bed net down at all. And in fact, even though people were being monitored with the Smartnets in this study, up to 15% of the nights, they just didn't use the bed net at all. And as you can see here in this plot, the likelihood of missing a bed net, missing a full night of use increases. Interestingly, it's this young adult age of 21 to 30-year-olds who actually miss the most nights. Often that's because they're either getting home late from work, school, or traveling. But clearly those individuals are at higher risk. And when you take out the nights that they miss the entire night, their average use is actually more on par with the other age groups. Interestingly, here we talked about this quickly. Even if people were reporting bed net use, right? So in addition to measuring them, we were also, as every 2 weeks, asking them whether they're using their bed nets. Even though people knew they were being measured with this, whiz-bang device, actually 11% of people were still reporting that they were using their bed net, even if they weren't. So what that tells us is that social desirability bias even extends to, being objectively monitored, and it's just something that's inherent. And that again is just additional evidence for me of why what the value of these kind of objective measures. So I think the overall take home is that, children under 5 and adults use their bed nets very similarly, but the school-age children use their bed nets much less often. And I think there's some really interesting insights that we can have by using these different metrics to try to understand why people use the bed nets the way they do. I'm going to go forward quickly through this slide. This is essentially a slide looking at the qualitative inquiry that I'm going to be working on. By using the Smartnets, we're going to try to classify individuals and households that use their bed nets quite well and compare them to households that use their bed nets not quite as well. and try to do in-depth interviews to try to figure out exactly why that is. We'll try to have them, describe circumstances in which they forgot to put their bed net down, or have them reflect on why they use the bed nets the way they do, and hopefully develop an actual model, a behavioral model that we can then validate in future studies. Because I think this part of it, when we're talking about different cultural understandings of malaria, and also talking about individual behaviors, obviously we can measure those with numbers quantitatively for a long time, and then we can guess on why exactly they're acting the way they do, or we can go and actually ask them. So I think this is really important work, and there's really no standardized model of behavioral model of bed net use. So I think that's going to be pretty innovative as well. And then I mentioned quickly some of the issues with the actual Smartnet technology. I'll spend two or three slides quickly on this, and we'll do questions. But as we talked about, it's pretty obvious you're being measured, and the ideal monitor would be totally invisible, because I want people. I'm actually most interested in figuring out how people use their bed net when they're not being measured. The Smartnet device was pretty complex and it's expensive. There were some battery issues. It's also, you can't really wash it. So the next device that I'm going to be using is actually accelerometers. So this has been used in a couple of different studies where these are small, like wrist-worn kind of Fitbit type devices that measure displacement in the X, Y, and Z axis. The advantages are that they're less obtrusive, right? So you can see in the bottom right in that silly cartoon that instead of having all of those devices and wires and fabric, you can actually just have this one little device in the corner of the net, for example. And the battery life on these can last up to 45 days. In addition, we're going to be able to measure not only when people are sleeping, not only when the bed nets are being folded up or unfolded, but actually we can actually measure people slipping out from under the bed net as well. And the bottom right here, you can see I have a manuscript right now where we're looking at a pilot study that they did in Liverpool in the UK, and we actually were able to get some very good accuracies for all of those different bed net use behaviors using a machine learning algorithm that we developed. So I think this is a really promising improvement, and I think it's actually going to make the use of this in research settings much more feasible. So in conclusion, maybe we can do a few minutes of questions. Malaria is still a significant cause of child mortality in Sub-Saharan Africa. Even pre-COVID, we were seeing a plateauing, and obviously COVID is going to throw some wrenches in things as well. And bed nets are one of the most widely distributed tools for health promotion. Hundreds of millions are distributed per year at very high costs. But there's a lot we don't know about how malaria transmission dynamics interact with individual behaviors, cultural diversity in their understandings of these bed net technologies. So my work tries to deepen our understanding of bed net use behaviors and hopefully someday, develop more effective interventions to protect kids from malaria. So with that, I'm going to thank all these different groups that I've worked with over the years and are still working with, and I'll be happy to take a couple questions if we have some time. So thanks so much.
Thank you so much, Paul. Let's open the floor to questions.
I had a question about the new device with the accelerometer. And I noticed really quickly that the sensitivity in that Liverpool study was around 73% for the net being down, and how you think that will be affect kind of, especially the social desirability bias and ability to tell whether it's in use.
Yeah, that's a great question. Yeah, that is one of the challenges of there are different ways of looking at the bed net use. So in that study, those sensitivities are coming from a controlled setting where they actually had individuals using their bed net, and then each time they did one of those behaviors, they were jotting it down in a chart, and that's kind of your gold standard. And then we're comparing the results of our random forest machine classification tool to that gold standard. One of the issues that came up in that study is that I only have the data as singular observations. And what it doesn't account for is the fact that when a bed net is down, it can't go down again the next time. So I actually think that some of those sensitivities will improve over time as we start to, we can build in some more logic. And I actually think it'll be upwards of 80% and maybe 90 in terms of like detecting the different bed net use behaviors. In addition, the machine learning model we're using is quite elementary. It's just out of the box in R. And there are, for example, like neural net approaches that moving to next. So I think this is just an initial pilot study. I think eventually we'll be able to achieve much higher accuracies with those accelerometer measurements. But that is a good question.
I have a couple questions. Hi, I'm Rebecca, I'm one of the PEDS residents. For the accelerometers, do they detect movement like on the opposite side of the bed if someone were to lift up or lift down the bed net? I see that they were like located in one corner.
Yeah, so the exact placement of where to put the accelerometer, we're still working on. In that study, they were put on one corner. One of the big challenges is exactly that part where people we call enter or exit a bed net. So they slip out from one side of the bed net, and if that's not on the same side, as the accelerometer, then obviously it may miss it. So exactly where on the bed net we put them, we may end up putting them higher up or on the side. We're still working on that. So I apologize for the cartoon. But you're right, the placement of the accelerometers on the bed net will be important. I think the sensitivity of these is so high, you could just think about the sensitivity of like a Fitbit. The accelerometer approach with adequately sophisticated classification kind of analysis, I think it's what I've seen so far, it's quite promising that it will be able to distinguish these things. But the placement's a big part of it.
And then my second question was with regard to the Smartnet. I wonder how it would change the efficacy, if at all, if there was like a bedtime like beep or timer to remind study participants to put down the bed net.
Yeah, I think that would be a very interesting potential intervention. I think first, what I'm trying to do next is what I'm very fortunate to have in this next cohort is measurements of the density of mosquitoes at certain hours. And so the reminder there we would want to key on is actually more towards when mosquitoes are around. And so I think one of the issues that I run into is it'd be interesting to use the device as an intervention tool, whereas right now I'm using it mostly as a research tool, right? I'm using it to understand how I want people to use their bed nets like they typically do, so I can then help them perhaps use the bed nets in a way that'd be better for their health. So but that is an excellent idea, and even a more something that's separate from the Smartnet would be if we understand, when people should be putting their bed nets down. We can even think of a standalone small reminder, or for example, a mosquito detector that, for example, could go off when there's mosquitoes present, just to remind people, hey, you maybe want to get under your bed net as soon as you can because there's mosquitoes around. But these are all pointing to great ideas for potential interventions to improve malaria. Any other thoughts or questions?
Hi, Paul, it's Kelly. I was wondering if you could talk briefly about the role indoor residual spraying has played both in your research and also in kind of like the prevalence of malaria in general related to bed nets.
Yeah, thank you. Yeah, that's a good question. So I didn't mention a whole lot about other ways of preventing malaria. There are three main ways, and then there are some kind of novel ways that are being used. Bed nets obviously is the one I've been focused on here. The second one that I'll just mention first before talking about IRS is actual treatment. So like case detection and treatment reduces the propagation of the parasite further, into the community. So effective case detection and treatment is a form of prevention as well. And then finally, the indoor residual spraying is actually where they'll apply pesticides to the indoors of households. And that basically takes advantage of the fact that mosquitoes, after they feed or before they feed, they typically rest on the inside walls of houses. And these insecticides that are on the insides of the houses can then kill the mosquito either before they bite you or immediately after, and reduce the propagation and actually reduce the overall population of mosquitoes. That interacts with bed nets in a lot of different ways. In our group in Uganda, effective indoor spraying, essentially effective indoor spraying with the regular use of bed net use in the normal manner, led to almost the elimination of malaria. So indoor residual spraying is incredibly effective, at least in these high transmission settings in places like Uganda. The challenge with it is it's very expensive, and actually it's very sensitive to the type. My intuition is very sensitive to the type of insecticide that's used and the program that's used to distribute it, because we're seeing now in that same group, among those same households in Eastern Uganda, a different formulation of insecticide having much less of an effect. So indoor residual spraying can be very effective. It's just we don't understand exactly the ways to do it in a cost-effective way yet on a large scale. And that's where bed nets come in.
Hi, Cheryl. I'm a PEDS resident. I was wondering why the nets aren't kind of designed to maybe fit doors or like windows instead of like having a bed net, because I feel like I was like looking up and the nets can't touch the skin and all those things, and the only challenge that I can kind of foresee is like it might be hard to customize the nets to windows and doors of different sizes, and it could like potentially reduce airflow as well, but thinking that that way it's always up whenever people are at home. Was wondering what the challenges are with that.
Yeah, thanks. That's a good question. So there's actually a whole new, a recent kind of movement towards, I would kind of categorize that under home and house improvements in general. But the idea of like screening.
Hello?
Oh, hello, you guys can still hear me? Screening windows, creating screen doors to prevent mosquitoes from coming in at night. Are all things that are being looked at as ways to improve malaria. In particular, these bed nets are actually, so some complaints they're if you ask people why they're not using their bed net, the most common complaint is actually it's very hot under a bed net. Like you alluded to airflow there. Irritation or damage from the skin to the skin is actually quite rare. And I've used them without any problems. I suppose if you have very sensitive skin, you maybe react to them, but in general, they're pretty well tolerated, around a bed. But home improvements, the challenge with home improvements is as they're expensive and they're much harder to do on a widespread scale. But certainly home improvements is the way that, for example, we eliminated malaria in the southern United States, over time. So that is the path forward, certainly in the long run. I think we're thinking about, tools that can be used within households at a lower cost right now. But that's definitely something to think about.
Thank you.
Yeah.
All right. Well, thank you so much, Paul, for spending your morning, at least on the West Coast here with us, to share your insights and your great work. You can tell you've simulated a great discussion. If it's all right, do you mind if folks have additional questions if I direct them your way?
No, I was going to ask that. Please send me, you can, if you have my last name, you can Google me and find me and send me an email, and I'm happy to talk, especially trainees and students. I'm happy to work with people. So if you have any interesting questions or interest in working on this stuff, let me know.
Perfect. All right. Well, thank you all. Just some friendly reminders. There's an evaluation currently. Twinkle has pasted it into the chat. Please do your best to fill it out. That would be great. And our next session will begin in about 7 minutes, looks like, or so, with featuring Chris Stewart talking about complex humanitarian emergencies. And with that, everyone have a great day.
Thanks, everybody.
Thanks.